Good afternoon. Welcome to La Clínica del Pueblo's live session of Dialogues for Action, our Diálogos para la Acción. My name is Soyana Barker, and I'm the Chief of Programs and Community Service at La Clínica del Pueblo. We are live in Twitter, Facebook, and YouTube. Please submit questions to the comment sessions of your social media or the social media that you're using, that we're going to answer them at the end of our dialogue. Dialogue for Action is La Clínica's strategy to engage with the environment around us and to foster three big areas. We want to first promote critical thinking. So dialogues is to think critically. Also to embrace the concept of healthcare as a human right. This is something that La Clínica is advocating for a long time, and we like to use the dialogues to think the ways to promote that. Also, it's a space to recognize that achieving health equity for the immigrant community will require socioeconomic changes that confront historical and contemporary injustice. Without thinking that, we cannot really move the agenda of health equity. Today, we're happy that we are going to be talking to the council member-elect, Christina Henderson. And we'll be talking about immigrant access to healthcare in DC. And nothing better to do that than having our executive director, Catalina Sol, to join us to help us with this conversations and dialogue. So please join me welcoming Christina and Catalina to this conversation. Welcome to.
Thanks so much for having me.
And welcome again, Councilmember-elect Christina Henderson. We're very excited to have you here and to say those words all together. We are hoping that this is going to be the beginning of many conversations over your tenure at the City Council, and that we can be a good partner to you, and our partnership can work well together. But first, we're really sympathetic to your journey, to your story, and we'd love to know how your life has changed since you've become elected, and that you can share a little bit about what the real experience has been of winning this election during a pandemic with your life and with your family.
Yeah, it's been wild. It's been a wild couple of weeks. It's hard to say. And, I think there's a mixture here, because I think a lot of folks already think that I am elected and I have authority. So I get a lot of emails and calls, and I'm like, but I'm not until January 2nd. And so I'm happy to, relay your message to a member who is currently serving. But also for me too, I'm wrapping up my old job. So there's still just a lot of things that are going on and moving pieces. But I've had really great conversations with folks thus far. And, as we talk about what does the agenda look like in the year ahead, I'm really, really excited to get started and working on behalf of residents in the district.
Yeah, and have a council that's all women. The majority of women. That's very exciting too, right? It's an achievement, and I think I'd like to think this is a resistance to what happened to this country. and in the local level, we have that achievement. So we're very happy that DC has created the space.
Yeah, I think it's going to be really exciting. It's the first time in decades that we've had a all-female majority. Well, we've had a female majority on the council. And I've been very vocal in saying that I feel like, the tenor and tone of debate and the types of issues that you debate are different when women are at the table, when women are in the room. And our views around community and what that means, like in a real way, and how we fight for community is different. So I think going into what we are looking forward in terms of the challenges in 2021, I'm really excited to work with the women who are currently serving, and then the new council members who are coming on.
But we definitely welcome not just the representation, but the gender equity lens that I know that you'll bring to the work, and that we always strive to integrate in our work. But I'd also like to not have you see that this is an interview where we're going to ask you questions, but really also invite you to ask us questions as well during this process. But let me tell you a little bit about myself. I've been the executive director. Well, I've been with La Clínica continuously since 1998. So I'm in the 20 plus. I don't go over the plus anymore, but you can do the math. And I've been in a variety of roles, including leading the HIV programs for 10 years, and then chief programs officer, and most recently, I've had the honor to serve as the executive director. So it's been an interesting journey for me to take this on during the pandemic, which has been a complete, I think one of the few things that we did not see coming, among the many things that we could anticipate were predictable events in this country. We at La Clinica did not anticipate this one, but now we can put it under our belt. But it's been, a real affirmation in many ways of the issues that we have always said are important for us as a society to address. The importance of our community as essential workers, and just the repercussions of not having health as a human right and health access for everyone in this country, what that translates at a moment like this. So, I think what we're really, we feel really fortunate that we have been a part of the District of Columbia all of these years, that has been a progressive city, a sanctuary city, and we're starting at a baseline of support for the concept of immigrant health and immigrants as part of the fabric of the city. But the rubber hits the road, I think is the expression, when it comes to funding, right? Funding the programs that will include us all. So we hope to get a little bit to that part of the conversation with you later. But just generally speaking, I'm wondering how you see immigrant health and how it fits into the agenda that propelled you to run, and what have been your thoughts about that so far?
Yeah, so actually, it was sort of a link around access to healthcare in our city that was a catalyst for me deciding to get into the race. And in particular, it was focusing on maternal health as it relates to Black and brown women in the district, which obviously includes immigrant women. But when you think, sort of on a bigger scale in terms of health access, obviously the first thing that comes to mind is around, hospital access, right? So the fact that we don't have what I would call a full service hospital east of North Capitol Street, I think it is crazy when you think about it, because you have half the city that literally has to come west if they have some type of emergency or care. But if you even just think beyond that, we know that healthcare is not just about health insurance, right? That is a small portion that makes up health determinant factors in terms of well-being of a human. It is literally around environment and housing and access to food and access to all of these other pieces that I don't feel like often is talked about in the public health conversation. But when we look at the data and we see the health disparities, it is not a question of, oh, we need to give people more insurance. It is literally around what is the ecosystem that we have around individuals that are contributing to the health and overall health outcomes. And are we creating a situation whereby individuals feel safe and comforted to, one, ask questions when things are going, like, doesn't feel right, something is off, but can I push back? Can I ask questions? If a doctor isn't really listening to me, do I feel like I have enough agency in, our relationship to be able to, voice my concerns and be an advocate for myself? And then you think about it also, around access to mental health. And I just think about it from what it takes to get a doctor's appointment in this city. Just like regular stuff. You call, ring, ring. Hi, are you taking new patients? Yes. Awesome. Great. When is the first available appointment? Well, I think we could get you in around February. Okay. But I have this need today. And so I feel like as the nation's capital, as a city, or jurisdiction rather, that has so much incredible wealth and so much incredible education, we can be doing so much better in terms of our system of health. And, I think it's a shame that we have the disparities that we do have as it pertains to Black and brown folks in our community, because we have the education, we have the knowledge. It's just, do we have the political will to address, the issue at hand? And I'm hopeful that, we can make some inroads there.
It's interesting that you mention the hospital, because when I think about the DC Alliance, which is really one of the issues that we convened, we were hoping that this conversation could help us have a conversation about. The DC Alliance was formed out of the collapse of DC General Hospital, which I still remember back in the district, and how that confluence of a hospital that wasn't working, the lack of a primary care system, and the tobacco settlement dollars, a huge public health victory that brought dollars to all of us, really launched this very forward-thinking, I'd say revolutionary concept, for the United States 15 years ago of a health insurance program that was accessible to everybody. And I, gonna just going to go back to the fact that I've been around for longer than I care to admit, but I do remember how hotly contested and how much coalition building was required to be able to have the DC Alliance, because we see it as an either or rather than as a continuum of services. And, I think our current struggle is that we have not caught up to where the health sector has seen that healthcare really needs to go. Not just healthcare access, but the model of care. So we have this beautiful program that is has all of the right principles, but is just short in its. It's short in the way that you can access it. It's short in what it covers because it doesn't cover mental health. And it's really sort of the result of a pact of silos in the health system that sort of got clobbered together. And, I know that, in your service in the council, you saw La Clínica and other partners in the health system and just about everybody come year after year and say, can we end this line that is really, hurting our patients? And they're all immigrants. They're all people of color, and nobody would say, no, we think that the line is important. No, we really do believe that your community or Latinos and immigrants are going to commit fraud. So we have to have it. Nobody would come right out and say that. We all think this is an appalling case, and yet we don't change, right? So I think there's that challenge for the district, right, of how we continue to update, our achievements in a way that people don't feel defensive about, well, we did this and now you're asking for more. But I think the larger issue for us, even above all of this, is just the lack of affordable housing in the district, and how even with a fix for the district, right, and district residents, there's this. It's we can just continue to push people out. So the lack of affordable housing, it's just this place matters. And for us, living in the district is a significant advantage if you're an immigrant, because you're in an environment that at least is trying to support. So affordable housing and integrated model of care, and really just sort of matching the Alliance to that evolving Medicaid understanding of health is sort of a key issue for us. And when I say us, I really want to say the coalition of providers and policy people and patients that have been working on this for a while.
And maybe this is the most important point, Christina, that I would like to share with you. How important we feel about Alliance, because I think before the ACA, Alliance was serving a lot of different communities. But after the ACA, especially because DC raised the bar on Medicaid, Alliance become the program that's serving those who cannot really be served by Medicaid, and then become people that got barred, right? That's the limitation of the Affordable Care Act, was really anyone who is not a citizen have problem to be even buying affordable insurance. So, and then the Alliance become this model of including everybody. But as you said, it's a very strange model because some people don't understand, especially the concept of health promotion and prevention. That's pretty much what Alliance is made for, right? It's made for, you do not wait until you get sick to see your doctor. You see your doctor before you get sick. And La Clínica is part also of this network of federally qualified health center, who is a healthcare model that does give you not only a doctor, give you a care team that helps you also to navigate the social determinants, right? To make sure. So this is well set up. But as Catalina said, every year that we try to enhance this, we hit the dollar wall. There's no money for that. And then Alliance and some of the other programs that we try to make more comprehensive get without funding. And this is that kind of the question, right? Like, it's unanimous on the council many times that, yes, everyone should have health care. But then we're not being able to stop the recertification that happens every 6 months, even though now COVID is telling us that we don't enhance the amount of people enrolling in Alliance, right? Because the theory before is if you stop the recertification, it's going to be twice as expensive. Mm-hmm. The COVID made this possible not to have the recertification 6 months, and we don't have twice of the enrollment. So I don't know if you could talk to us a little bit. What is the strategy to make what the council decides something that can be funded? On the
I mean, so yeah, I think you bring up a really good point in that COVID has presented some very weird opportunities around what is possible, right? So for so long, where there's no possible way that we can't, as you said, go without a 6-month recertification. There's no possible way. I mean, I'm even thinking just like, there's no possible way that we can allow people to get alcoholic beverages from takeout, or there's no possible way that we can shut down streets to allow eateries to have outside access. And now we're realizing, like, not only is it possible, but it can happen quickly. And I was actually talking to some friends of mine around what does a post-COVID environment look like in terms of vaccinations, right? Like, how are we going to, quote unquote, go back after we have experienced a certain amount of time where we have changed policies and procedures on some things? And I think that there are some things that are going to stick. And I hope that this is one of them. In terms of, we now have demonstrated that the talking point around recertification is a moot point, right? We have demonstrated that you don't see these massive amount of fraud, you don't see this massive increase in terms of the number of people who are enrolling, and we have also demonstrated that it is necessary for a continuum of care, so that people are not seeing gaps in access and coverage and, the availability of services. And so I certainly will be pushing as we continue forward around what have we learned from this time? We've learned a lot, right? We've learned so much in terms of I would say, what does the term public health really mean? And I'm hopeful that we don't go back. I'm hopeful that we are moving forward and using this as an opportunity to just strengthen our systems, so that the next time we face a pandemic or, some type of critical public health emergency, we're not having to scramble.
Mm-hmm.
So yeah.
Yeah, and I think that there's also the issue that, yes, some costs are going to increase, and is that the right investment, for the city? Because to some extent the increased costs have always been predicated on more usage, right? And there's sort of a perverse argument when you use that in health, which is, oh, we're reducing costs because less people are using a benefit that they're eligible for, and there's all of the alternative or hidden costs when people are not enrolled in primary care, they're not getting mental health services, and then how those play out in the larger society. And so, from the community side, there's at some point where I said, okay, it's not up to us to have to make that cost argument, because we don't, we're not economists, we're not macroeconomists, and we cannot come up with the cost per lifetime savings per individual that would make this argument. But the case has been made, right? The case has been made by other economists about and it's the foundation for large national endeavors to invest in primary care, mental health, integrated care, versus waiting for people to get sick, so maybe we can use this body of evidence as a proxy. But I do think governing is tough, and there's we at the clinic are facing 2021 as a year with, as all of our sister health agencies, of continuing economic challenges. We just don't know where things are going to go. We didn't know where they were going to go this year.
Yeah.
Now we don't know where they're going to go next year. So who knows? But I'm curious about it's reading a lot and following your trajectory. It seems like you've given a lot of thought to like how this is possible, how we get it done. And what's that sweet spot, and what's that relationship with coalitions that you would like to have to be able to move realistic agendas forward in the future?
Yeah, I mean, I think I have been giving a lot of thought in terms of how do you be effective in governing in the midst of tight or perceived tight budgets, right? And I think a lot of it is around timing, a lot of it, at least for coalitions, right? How do you prepare your case so that when the political time and opportunity is right, you're ready to jump on it? Because what I really feel like is going to be incredibly important for us in the next year is to be innovative with how we use the dollars that are coming to us from the federal government in some ways, right? So if we are taking federal dollars to use it to pay for one group, does that free up local dollars in order for us to be able to do something different? And do we as a council have the patience and the will to work with the executive to do these creative thought exercises as opposed to just doing how we've always done it this way. Okay, well, we haven't always been in a pandemic. So let's do something different so that we can make sure that we are providing for, folks in our city so that we can ensure that they're getting what they need to be successful. My husband and I, we were actually talking about this earlier today in terms of like vaccine distribution and just sort of the idea that it's going to be easier for places like the United Kingdom to do this because they have a nationalized health system, right? It is, we as in the United States, we, even in the District of Columbia, we are jumping through hoops around silos and pieces of who gets what when, because our system is not centralized, because our system is in silos. And I know that will take us into a completely different conversation around health access, but I'm just sort of thinking like, we're already gonna have to be thinking more creatively. Don't miss this moment to come out on the other side that is stronger and that is working better for people, because that is the whole reason that we decided to do this, right? It was for the people to ensure that they had access to healthcare when they needed it. And I'm always, it always kills me when I hear this often in the Senate too, where people say, well, if we make it too easy for people to get it, they'll abuse the system or they'll do more, or, and to me, in some ways, it is just a fundamental misunderstanding of people, how they view community, how they view benefits, and how they view time. I don't have time to take off work 5 and 6 times to go to a doctor's appointment for which I don't absolutely need, right? When I am making an appointment and I'm taking off time, or I'm taking my child out of school, which is very valuable and important in our communities, to do this, it is because we have hit a level of last resort. So I think it is always so insulting to me when you think that like, oh, well, people are going to abuse the system.
Yes, as everybody likes to see a doctor, right? And this is interesting because for us has been always the what we're trying to explain, right? I mean, in terms of our community. Of course, you want to be protected, right? And you want to feel that your family is protected. And when you feel that somebody's sick at your home or you're sick at your home, you'd like to have access to somebody who calms you, right? But this should be a trusted relationship. And many times the marginalized communities, the excluded communities, they don't feel protected when they go to a healthcare facility or when they talk to a provider who boss them around, right? So we have a lot to kind of think about a model too. I think what you said before, like how can we empower people, but also how can we have systems that people feel respected enough so they can ask a question to someone who can help them to feel safe, right? And to feel protected. I mean, you have your trajectory with women and I mean, young women especially, like young women pregnant. There's a mistreatment many times, right? This is when we have a La Clinica, sometimes we get immigrant women too late sometimes for a good prenatal, right? Because they were afraid of the system. They were ashamed that they were pregnant. They feel that they're going to be judged. Many times they are surviving violence and they don't know if they can talk about it. So I think for us, and it's being incredibly, I mean, I'm so happy to hear you speak like that, because I think in some ways thinking great with this US environment, not being England with a centralized, how can we value something that's similar to it, right? And I think the model of the Federal Qualified Health Centers and how primary care concept of a place that is a care team. It's not one provider who is going to give you a hard time, but it's a care team that's there to help you to navigate. It should be promoted, right? And for us to learn about it. And DC has a very incredibly good system of those healthcare centers. Mm-hmm. We need to talk more about it, right? Places, and have this also all over the city, not just in one side of the city, right? So everybody feels safe to go to a doctor. But also, I'd like to, maybe, Kata, we can talk a little bit about mental health. What do you think? I think we have that also question.
Yeah, I think it's on the lines of trauma-informed institutions, right? Because to piggyback on what you were saying earlier about the assumptions that people make about, well, we're going to abuse a benefit and they don't really see what our lives are like, I think that's played into it's played into the long-standing assumptions that it's okay to stand in line, it's okay to have to come in person for, like, our communities can't do things by internet, we're giving you something, so just put up with it, right? I mean, and that's the classism behind so much of the social services, right? That the foundational classism that so many of the social services are built on. And so we know you have a lot of interest in trauma-informed care, in mental health services, and there's this real fragmentation, between the health and the mental health system still in our city. We have 2 electronic health records that we have to use, as a medical provider that also is a vendor with the Department of Behavioral Health, and it's there's a control, right? Of everybody wants to control their own area, but integration goes, as you said, at having to change the way that we always do things is one of the hardest things in any of this, So we do think, speaking of the Alliance specifically, that it's very limited by not having a care management benefit and not having a mental health benefit. But more broadly speaking, how do you see mental health for all? We've talked about health for all, but sort of like mental health for all as a policy, and the way that our institutions don't continue to create traumatic situations, with the health system. We have now to surmount all of the traumatic events that our community has had with the health system to try to get them vaccinated, so it's backfired again, in this horrible way.
Yeah. I want to say, I do recognize the limits in terms of what the council can and cannot do in this area, right? Because when we talk about trauma-informed institutions and trauma-informed care, a lot of that is literally, how do you get a doctor's office or a provider to change their systems, to change their approach, to change their culture, right? In terms of the nurses and doctors and all of the individuals who are part of the staff there. And I don't feel like that's something that you can legislate. I can incentivize you to make some of these types of changes, but I feel like it never works well, or it never works as we intend in that way. And so one of the things that I'm very much interested in doing in terms of how do we get to this place of like mental health access for all is, one, how do we strengthen our laws around telehealth and mental health services? And again, this is like where COVID has kind of changed the game, right? Now, all of a sudden we have way more providers who've had to switch and, provide that via systems, et cetera, where I don't have to come in person for, it doesn't require a physical, like if you don't have to do a physical evaluation, we can have a conversation. I don't have to travel. I don't have to sit in your office, like all of these different things. And I still get what I need. But one of the struggles, at least that I have seen that we have in the district, is that we just don't have enough providers, period, to meet the demand and need, particularly in the mental health space. And so how can we use tools at our disposal to really target in that area? We have a law in the books that is like a sort of like a public service loan forgiveness program that's a local, but it's specifically focused on health providers. We can tailor that in a different way to, one, target to the specialties that we need, but also, Siana, as you sort of mentioned, like, I don't need you all on one side of the city. I need you to serve so that people don't feel like I have to get on 6 buses just to go to one doctor's appointment. And, let's lower the bar, let's lower the access. And I really feel like this could be an opportunity and a way for us to recruit and retain mental health providers in the district, in the hardest to serve parts of the city. Mm-hmm. But, the joys of creating a local program is that you can add specific requirements. And I would say that one of them is around, taking patients who are part of the alliance, because we have, I don't know, I've heard so many stories from friends and et cetera, right? You have insurance, but your insurance coverage doesn't take mental health access, or the particular therapist or person that you want to see doesn't take insurance. So you have to make a decision around, do I work with a person who I think can help me and who I feel comfortable with and just pay for it out of pocket, or do I do something different, which might require a longer wait time or a longer access point? And so I think on the council side is really around, one, are we listening to patients around what you need? Are we listening to providers around what you need to either scale up your services or to help you beef up what you're offering, to really get to this point of, you need a therapist? Let's talk to somebody before you make some other type of decision that might be harmful to you or others in the community.
Mm-hmm. Yeah, and I think that just to share, we the model that we have at La Clinica, we have created those spaces that is just not really a medical provider. It's like, we call them, looks like a little bit like a social service agency, but it's also not. So we call them just like community centers. And we have one at Mount Pleasant Street, La Casa. And the whole idea of that model is having an entry point that you don't need to have an appointment, you don't need to have insurance, you don't need to really know what you need, and we help you to find it. So I think just to think about it, we can do more discussion about that. The importance of having, as you said, easy access, right? Sometimes people have, and we think about mental health, especially people surviving trauma. Anyone who talked to the therapist for the first time, this first time is not easy, right? Because you have to be like, it's so much internal energy to have the courage to sit in front of someone and talk about your problems that you're ashamed of, right? Many times we're judging ourselves to be suffering like that way. So,
or to even just get into the waiting room.
I know, because you're the limit, right? So
I especially think that, right, in communities of color, especially, Black and brown communities and immigrant communities, because there is some still lingering stigma around even you need to go see someone. Why don't you just, do this, or, go to church, or, all of it is, yes. It takes so much to get to that first meeting. And then the first meeting, it takes so much even to just say those first words. Yeah, I get it.
Yeah, and then you have something that says, so what's your insurance? What's the copay? We have to find a way, right? The systems where people feel really respected, because the rest comes more naturally, right? And I think, and this is integration for La Clinic's integration of the public funding systems that prevent and promote health in association with insurance-based care, because also you need that system. So, and there's so much for us to think about it and to talk about it and create systems. For example, we did once with immigrant women, this whole kind of intervention where we taught them what to talk to providers, right? Not necessarily have an appointment and empower them to have a cervical cancer screening, but what to talk about on that cervical cancer screening, right? Other questions that woman may have, and how to. So I think we need more of that. So it's good that you think about that too, because the whole access is not only one entry, right, on one way, but it's more like us creating a system that's really, we call this culturally appropriate, because sometimes people think for immigrants and for Latina, culturally appropriate is just be colorful. Colorful is very important for us. Everything that's color is good for us. But it's more than that. It's also being inclusive, not judgmental, and also, especially as Catalina mentioned before, not classist, right? Not assuming that person is a mistake just because the person has some limitations that's provided, and it's not a personal limitation, it's a limitation where the person comes from. We have some questions, but maybe we can keep our conversation and we go to the questions at the end. What you guys think? Okay, Kata, we do this way. We keep the conversation.
I think we can continue with both, right? As they come in and they're relevant. I had a thought about mental health that I want to make sure I don't lose before we go to the question, which is that
yes, say your thought.
Yeah, well, just to share that really during this pandemic, our service that has been most successful to transfer to telehealth has been mental health services and even addiction counseling services, and we've had less no-show rates in that area because it's decreased a lot of barriers for people to get physically out of their house and into the clinic for their mental health appointment. And I just want to say, I think that the city really did its homework, during the pandemic to be able to make sure that we can keep telehealth and audio visits, because this is where some of the digital divide has really, really hurt us and will continue to hurt us. So in the medical area, we have, people calling on the phone or coming in because just the bandwidth, the devices, the privacy, everything that you're very familiar with is just not there. So I think that the dream is to be able to recover into a new place, not to go back, right? None of us want to go back to where we were, because how did it favor us in any way, in so many respects. But I do believe that it's going to be a struggle, that it's not going, we're not all on the same page about it. So I'm hopeful that we have enough evidence and experience that things work and that they make more sense, that we can bring into the future. But I don't think it's going to be automatic. I think we're going to have to really cement it in whatever way we can. Should we read the question? Yeah, go ahead.
I was just going to say, I think this is where providers in terms of documentation and storytelling is super important, right? Organizations like La Clinica, your information and knowledge is certainly, I would say, more robust around the inner workings of, using telehealth for this than I would say the Department of Health or Healthcare Finance or, the council for that matter. And so this is where I feel like stories matter around how it's changing, even just the no-show rates, right? Like, I think that is hugely, hugely indicative of this is an individual who might not have otherwise made it. But is getting this
Yeah, no-show rates are typically quite high in mental health, and so that's a huge gain in access for the people who we've been able to get through. There's all of the ones that we haven't been able to get through that we worry about.
Yeah.
Suyana, do you want to read the question, or should I?
Yeah, we have a question about access to vaccine, right? And I think it's something that is in our radar too, right? I mean, how to make COVID testing available, and also the support for people that cannot work because they are in quarantine. I can imagine this is a little bit the question. And also something about fair access to COVID vaccine. So we have the COVID now. The audience want us to talk a little bit about it. And this has been our concern too, right? I mean, how to make sure the excluded workers get helped too, because they are part of the fabric of the city, and also can help us to, on the month until we have the vaccine for everybody, support for people to quarantine, right? Support for people to really be at home and not be without food and without the housing because of that, like that.
Yeah. So, I mean, I'm having discussions sort of like in a two world prong, right? So on the Senate side, I work on education and labor policy in my day job. And one of those from a COVID perspective of a provision that we're working around is the emergency paid sick and safe leave provisions around, if someone has to quarantine, they still get paid for the amount of time that they're out, that they have a certain amount of job protection, all of those different things. All of those provisions expire at the end of the year. And so this is part of the ongoing debate. And I'm always of the belief, like, if the public health emergency is still going, why wouldn't we want people to stay home when they're sick, or want people to stay home when they might be exposed, if we are saying that our top priority is around limiting access? And then last week, I kind of went down this rabbit hole. Was it last week? It might have been Monday. I don't know. The days are sort of running all together. But specifically on vaccine access, because I don't actually think this is getting as much conversation as people. I feel like the news about the vaccine being available this year is getting more outsized coverage than the actual logistics of who goes first. Mm-hmm. And there is actually a debate that is going on amongst the advisors to the CDC in terms of what happens for phase 1B. So not healthcare workers, but like the next group of individuals in terms of who has access to the vaccination. And, I was reading articles by some medical ethicists who were basically saying, like, if we're going to do this from a social justice aspect, if we're going to do this from an equity standpoint, then essential workers need to be part of the conversation, because we tell them, and, essential worker, right? 70% of our workforce is technically considered essential. So it kind of is a weird thing. But if we're saying essential worker who has direct and ongoing contact with other humans, grocery stores, delivery folks, even if you work in a warehouse setting, a lot of the jobs that I would say like immigrants are currently working in fall into that category. And basically making the argument that if they were essential enough to keep working throughout the pandemic, then they should be essential enough to receive the vaccination and be protected so that they can continue to provide the service that we say is so critical and so essential. And, obviously every jurisdiction will have an opportunity, like they're guidelines, they're not requirements. So CDC will say what they want to say, but then I think it's going to come down to the district in terms of who goes next, who was part of that conversation in terms of the decision-making standpoints around who goes next. And what does that look like based on what the data shows around who has been disproportionately impacted by this virus in our community? We know, we already know, right? Who it is. And even though people sometimes are like, we have no idea how they managed to get it. And I'm like, these are the folks who are taking the metro every day. These are the folks who are interacting, with people every day. Sometimes people who are not properly wearing their masks. Sometimes people who are not properly, guarding their faces when they're sneezing. All of these different things, like they're being exposed to the elements, and so there's just so much work. Well, once you decide who gets it, then I feel like there's this other level that we're not really talking around building trust for individuals to decide to take it.
Well, we've been having, there's so many things to say about this. I mean, one is, right, we've been talking about that for a while, like how long are we going to be essential? Essential for whom, essential until when, right? So, I mean, I love the marketing around essential workers that started almost immediately, from every company. It would make me weep and cry, and it makes you feel like, yes, we're finally seen, but only until, right, we stop being essential. So, I definitely do think that we need to be loud and consistent about that from the very beginning, because we're going to just have to claim it, right? Nobody will choose us. We'll have to choose ourselves and get there on the table. It's strange that it's even an ethical question, right? Because all of the data so far has pointed very clearly to the communities that are affected more by deaths, and so forth. And I think for me, one of the things that comes up is, people will continue to go to work and expose themselves if they can't if they can't pay the bills, right? So this combination of both health access and ability to stay home without being evicted and being able to pay the bills is just fundamental, and we all know that. But the other piece that I want to speak to from the health center standpoint is the federal relief that we received, that all of us received, to say, like, it's okay if the person has COVID, right? They can, if it's for COVID testing, if it's for COVID care, and now for COVID vaccine, you can get in. It's just terrible healthcare and just a logistical nightmare, you know, and that is, it's just not effective, right? Because people are entire people, you know, so you can see the thumb of them that has COVID, but not the rest of them, you know, that has everything else. And, you know, people, we've discovered that people, and have identified people with COVID because they're coming to healthcare, not because they're coming for COVID care. They're not different from each other. And every health reimbursement system that has been based on a single diagnosis has just created additional inequities and imbalances that we've had to redress. Like, just thinking about our long experience with HIV, you know, the other pandemic that we've been working on for years, and how even at some point being HIV positive was considered to be, or you've got the extra advantage because you have access to healthcare through the Ryan White system. But if you're negative, you don't. And how does that become so distorted? So, you know, I do think that the immediacy, right, of the need is just going to keep us having to deal with these patchwork solutions at the federal level. You know, there's somebody else waiting for their transition along with you, right, to be able to make some change. But in DC, we have an opportunity because we already laid the groundwork for you know, at least almost universal coverage, right? At least, so there's some of these things can be approached more holistically as opposed to just for COVID vaccine. I don't know if that our undocumented workers and anybody who's excluded from the health system is going to be less likely to receive the vaccine because we don't know where they are, you know, and that's the core fundamental problem. Then we have the issue of trust, right? We've traumatized them and now we want them to trust us. So, you know.
I mean, it's not just the trust, but also, I mean, when I met with Dr. Nesbitt during our intro meeting soon after I was elected, it was around, how do you build out a logistical system to remind people, hi, you need to come back for your second dose, right? Like, and that requires you, upon intake, getting a certain amount of information so that I can, quote unquote, chase you on the back end of whether it's a cell phone number, whether it's an address. And I recognize these are some things that folks may not be comfortable providing information in terms of giving it to the government. And I do think it presents this very interesting challenge for us because from just a logistical standpoint around, you know, does the La Clinica have freezers to be able to give out the vaccine yourself? You don't. So we're going to have to use our community partners to essentially get people to go. There's so many moving pieces here. But I think one of our focuses should be, especially like, you know, let's forget what's happening on the federal side. Let's just focus on how we protect our folks here in the district. And I think we are seeing signals of that by even, you know, the mayor announcing like, okay, we're going to give people checks. Right. We haven't even got to the checks part on the federal side, but the recognition that it has been 8 months at this point, and even longer in terms of stretching on. And so I think that we've already shown an independent streak. Why not let us just be the example for how other jurisdictions should be engaging in their COVID vaccine distribution from a social justice framework that does not leave out the undocumented, who are members of our community, providing essential work, providing essential functions. And even if they weren't, but just being here, it's a public health crisis. If you want everyone to be safe, everyone needs to be vaccinated. So, you know, what are we doing there?
Yeah, well, this is incredible, right? Because he's being what we keep telling all the time, like, don't leave anyone behind, because we've been telling this for so long with HIV, but also the whole idea of people having more, being more vulnerable for chronic disease has to do also with how we left some people without capacity to eat well or have access to healthy food. So And for us as healthcare providers, but also part of this idea of understanding health system, I think we can be a great partner to also explain what's going on with the community. So I think part of this conversation with you today, and we're getting to the end of it. So it just, I think in some ways we want this to be the beginning, right? I mean, at La Clinica, we like the fact that we feel very close to our community. I mean, 80%, I think more than that, of us at La Clinica are immigrants, right? Me from Brazil, Catarina from El Salvador, but also we have the immigrants from Africa and the immigrants from the Middle East that has around us too. So I think that immigration is something that we understand very in our guts, right? It's not only so, and we can help facilitate the bridge, right? The bridge to you understand our community too, or you see where our community get engaged with other communities, and how we can, in some ways, be a resource also for you understanding the city. For us, it's going to be easy to have this dialogue with you, because the conversation today, we're on the same page, and 99%, I would say 100%. So I think this dialogue is going to be very easy, but I think we represent different components, right? You legislating, as implementing. So I think we can support each other, and I would like invite you to have on us this dialogue that's starting today, but we'd like to support your work. I think we have some questions.
So I just want to put in a statement about Dr. Nesbitt, just to say like what an incredibly fierce and effective leader she has been in this pandemic, because this is the thing also about the district, is the district has been leading in the COVID pandemic. Like, aren't we glad that we live here and not someplace else, but, and so many of the challenges. Yeah, I mean, we have high standards. The district has high standards, and so we push each other to be better. But I feel fortunate when I look at the national news every once in a while, to say like I'm glad that we're here, and not someplace else. But that shall remain unnamed. But the question that we really have for you is, what can we do to make our issues more visible to you, and to other council members? I think we're fortunate to have really good working relationships with other champions on the council that have really moved immigrant health issues forward. But it's hard for us to think what would be helpful. You mentioned earlier the storytelling. But when we think forward about how we can help you, in the role that you play within this, not the fix all role, but the role that you get to play in conjunction with partnerships, what's helpful from us? What does that look like?
And I think this is also a question, Christina, from our audience, right? One of the questions, like, how can the trauma of immigration and acculturation can be visible on the decision-making process, right? And so one of our audiences asks, it's similar, it's complementary what Catalina said, like how can the struggle that we are dealing is become visible for you all on the decision-making process?
Yeah, so I mean, I think that for those who are sort of in the policymaking space, how they are moved, or how they view a table or a space looks very different. I think for me, I'm always looking for what are the underrepresented voices that are hugely impacted by this, but aren't often invited to the table. And how can I use my place and power in order to like elevate those conversations and bring it to the table? But one of the things I would definitely suggest is around, I don't think it's necessarily a lot of what we talked about today is not necessarily uniquely an immigrant health issue outside of, say, the DC Alliance, right? So, I mean, but just sort of the issues around access, the issues around building trust, the issues around systems and institutions that are trauma-focused, trauma-informed focused, all of those things, I think that in fact impacts everyone. And so what I always advise and suggest is around like being at the table for those general conversations, even if it doesn't have a specific lens or focus around the immigrant community or immigration lens, because you can always bring that to the table so that it is part of the larger conversation. And I think that that is going to be key and important, because we don't want our system to be about silos, right? Specifically, there are some things that are just not everyone is going to understand and not everyone is going to get. But if we want to truly elevate the issue as a whole, we have to capture people on, you know, those larger, bigger health concern, health disparity issues, health process, health access issues, right? And, you know, Catalina, I want to echo what you said. I feel like Dr. Nesbitt, for all the criticisms that she gets around some of the things that have gone wrong, I feel like for the most part, DC has done this better than most jurisdictions. And I think as we go into sort of this next phase of conversation, I think it's, you know, we got to push to make sure that we are, as we say, a value of our city is to leave no person behind, then we need to make sure that we're living out that value in our practices and procedures as it relates to COVID vaccine distribution in the next, you know, coming 6 months here. And I'm certainly going to do my part to elevate it. And, you know, I want you guys to definitely see me as not just an ally, but a co-conspirator in terms of getting the work done. And so if I miss something, call me, call my office and say, hey, you missed X, Y, or Z, or hey, I think you only have one perspective on this. Here's another perspective of how it's working a little bit differently in our community or the specific issues here. You know, I think sometimes people make assumptions around, well, you should know X or you should know Y. I'm always quick to say I'm not an expert in certain things, right? I am not an expert in what it is like to run a clinic. I am not an expert in providing, implementing the programs on the care side. And so the only way that we get that information on one side, yes, is seeking it out. But on the other side is for folks to raise their voices and say, hey, I have expertise and you're getting it wrong. Let's have a conversation. Let's talk about how we can do it better. Or, hey, this is a place that we need help. We have not gotten feedback, or we have not gotten, you know, folks in a particular agency or whatever to like, to respond. Can you help us? Can you raise this issue? Can you be sure to always put this at the forefront of the table? So I think that that's part of it, right? Infuse it in every conversation around healthcare around the city, to the point where people are just like, it is a natural part of our conversation.
Mm-hmm. Yeah. So
that's incredibly helpful advice. Thank you so much.
Yeah. And so with that, I think one thing that we're not achieving today, and maybe next time for the conversation, we're not able to make this moment what we call a language justice moment because of the technology limitation. We could not provide simultaneous interpretation so people could hear your voice too on their language. So this is something that we could not do today. We're trying to do in the future, but I also ask you to advocate for that too. I mean, it's very important having bilingual and simultaneous interpretation systems, not only Spanish, but we have a Amharic population that sometimes feels very, also Chinese population, and French-speaking population that sometimes feel out of the conversation. So, and we could not do today because we could not figure out, at least in Spanish, how to put the simultaneous interpretation here, but it's something that we try to do all the time because it's very important, the dialogue with both ways, and this is a strategy to do that. So next time that you come to dialogue with us, we're going to find a way to have also our community who speak different language to be able to, in some ways, participate and have. So I'd like to thank you very much, Christina, to take the time. As you said, you're like your busy life and you're ending one job to start another one. We felt so excited with this change that we decided to reach out to you. And thanks so much for the kindness that you and your team answered us and were open to talk to us. I think says a lot, right? I mean, you had one already and you pretty much behaved the same way that we're behaving before. So this says a lot. So thank you so much. And I'm looking forward to keep dialogue with you and your team next year.
Yeah. I mean, thank you so much again for the invitation. This is our first conversation. This is the beginning of a long relationship and friendship, and hopefully in the future we can gather in person and do this in person. But for right now, I'm open. My office, well, I don't have an office yet, but when I do, it will be open as well. All of the things. So
I just want to wish you a restful rest of December as much as you can. I know that you're going to hit the ground running, and just take that time for yourself so that you can be there for the long haul. It's been really a pleasure to meet you.
Thank you.
Yeah. And at the end, I'd like to invite Rodrigo and Lina in. Can you guys come in alive so people can see you too?
Oh yes, yay!
Rodrigo and Lina. Those are the people behind the scene that could not possible without them. So Rodrigo and Lina, thank you so much for this health equity initiative at La Clinic that you guys lead and put in place. The Atlas is a huge success and a place for us to meet people. So thank you so much for your support and conceptualization, not only support, right? You guys are behind the whole structure of this event. Thank you so much.
Thank you.
And everyone who was listening to us and watching, thank you so much to be here with us today. And we look forward to have more events and have more of this adventure of having conversation in a streaming, not knowing exactly who is watching us. But anyhow, this is how we are now. And thank you so much again for being here, all of you.
Thank you, Christina.
Yeah.
Bye, everybody.
Bye.
Enjoy the holidays.
Happy holidays.